Welcome to the More Than Teeth podcast, where true health transformation begins in the mouth. Join your hosts, Dr. Michael Bennett and Kathy Bennett, as they explore the hidden connection between your mouth and your overall health. From sleep and airway disorders to nutrition and systemic disease, they're on a mission to help patients and healthcare professionals see oral health as the gateway to total well-being. So, let's get started.
Welcome, everyone, to the podcast. I'm your host, Michael Bennett. I'm a dentist by background and have specialized in my clinical practice in treating airway and sleep disorders in addition to chronic pain. And I'm glad to be here with you today to share some things that have been on my mind. Of course, as we think about, just go ahead and think about your family history of whatever chronic diseases. What did your grandparents pass away from, and what diseases is your family struggling with? It could be cancer, high blood pressure, diabetes, a number of things. If you could find something that could promote the natural healing processes in the body to help fight those diseases, would you be interested in finding out what that is and how that would work? Of course, we all would. The podcast theme is Unleashing the Healing Power of Sleep. When does the body heal itself? Well, it's during sleep. And what gets in the way of good quality sleep and the reparative process? Well, oftentimes it's inability to breathe in a normal, quiet, relaxed way through the night. So I want to throw out a few thoughts to you. As I was reading this book called Intermittent Hypoxia and Human Diseases by Springer, there were some really interesting correlations. I would preface this by asking, what are the major things that are killing Americans? And if you go to the National Institute of Health statistics, 2016 and 2017, you'll find a really nice outline. The number one and number two leading causes of death of Americans, guess what they are? Is it any surprise that it's heart disease, number one, which includes all types of heart disease, and cancer, and all types of cancer. And those by far are more than 3 or 4 times more prevalent than the other categories that are listed. So, for example, heart disease kills 165.5 per 100,000 Americans per year, and cancer is just slightly under that. And then other things. The third category is unintentional injuries. And as we think about, well, how could sleep or sleep deprivations, low sleep quality affect those top 3 conditions? Well, this book that I mentioned earlier has some strong evidence that intermittent, meaning periodic breathing droppage or breathing stoppage and lowering of oxygen in the body results in a lot of different compensations in the body. One of them being that it increases the amount of cholesterol levels, not the good cholesterol, the bad cholesterol, and you end up getting more atherosclerotic plaque build up in the veins when we don't breathe well. And in cancer, there's evidence that even with cancer, as our body pH decreases in our bodies, as a result of lowering of our oxygen and increase in carbon dioxide. Remember the chemical equation for all you chemists out there, that 1 molecule of water plus 1 molecule of carbon dioxide results in carbonic acid. And so as we increase our carbon dioxide in our bloodstream, our pH increases. And as it turns out, the oncogenes within the cells, which changes a normal cell into a cancer cell, they tend to get turned on during those low pH events. And respiratory acidosis is a condition that's related to when a person just doesn't breathe well frequently through the night. And that can occur in children and adults across the board. So, interesting thing. And then unintentional injuries. Well, how could that relate to sleep? Well, is it possible that drowsy driving could result in those types of injuries? Or we're trying to hang Christmas lights up on a ladder up against our house, and our reflexes aren't as good because our brain's tired. Could that also contribute to those types of injuries? And then there are a number of other ones. Reading down the list: chronic lower respiratory diseases, like asthma, COPD, stroke. As it turns out, that we are 5 times higher at risk for stroke if we have a sleep apnea condition that's not being treated, meaning obstructive sleep apnea. And of course, that's horrible. How many do we know that have had a stroke? And it's one thing to pass away from a stroke, and then we're done, obviously. But it's another thing to survive a stroke and then be disabled for the rest of our lives and have to have family members take care of us. There's very few of us that would want to be or feel like we are a burden to our families. So Alzheimer's disease, that's the next in line. Anytime we have low oxygen, the gray matter within our brain and the cortex, meaning the outer portion of our brain, that actually starts to decrease. I have personal experience with that, where my father passed away, 75-ish, 75. And I'll never forget, as I got into studying more about sleep, I requested his medical records, and his MRI findings indicated that he had a condition called watershed ischemia. And it's where the prolonged hypoxia results in the gray matter of the brain starting to decrease and thin out. And there's a recent study that I read that also supported that this idea happens when we have lower oxygen on a regular basis. So, of course, brain damage occurs when we're depriving the brain of oxygen on a regular basis. It's amazing how resilient the body is, that it can withstand this type of abuse. If we drink alcohol, that's a central nervous system depressant, and that just exacerbates all of these issues. In terms of what alcohol does, alcohol tends to dry the tissues, and it tends to inflame the soft palate and tongue of the mouth, oropharyngeal space. And so you will end up with a more narrow airway. We've all seen those old shows of the drunk laying down snoring. And of course, snoring is a major risk factor for having obstructive sleep apnea. So all you out there that are snoring, don't turn the other cheek. Get that checked out, because you are definitely at risk. There are some studies that say as high as 90% of loud snorers actually have sleep apnea. And so interesting things that to consider. Diabetes is one of the up-and-coming problems. There are the obesity rates are climbing every year in the United States. The rates of diabetes, they estimate as high as 1 out of 2 people will have pre-diabetic conditions in the next 5 to 10 years. And that's insulin resistance is a very common condition that is associated with us when we are going through these states of intermittent or frequent in and out of having oxygen levels at normal amounts. So influenza, pneumonia, those are respiratory issues. If we are not sleeping well, our immune system then is not going to be as robust and able to fight disease. One of the things that I concentrate on in my practice is making sure that we are nasally clear and we don't have any issues, so that the actual filtration system of the body is working. And then to round out the final, the top 10 reasons for Americans dying, the last one is suicide. And how can that relate to sleep? Well, think back to the time when you were deprived of one night of sleep. And how did you feel the next day? And then maybe a second day you were deprived again. How did you feel? How depressed were you? I know that if I miss one day of sleep, boy, I'm not in great shape emotionally or socially. And so perhaps that's related to it. Certainly in my area, there's a large amount of or prevalence of the use of anti-anxiety and anti-depression medication. And there's also a high prevalence of people needing braces. Is there a correlation? Well, as we've mentioned in previous podcasts, when we have narrow upper and lower jaws, we also frequently have narrow airways. In other words, the airway above our mouth, which is our nose, and the airway behind our mouth, which is our throat. Those airways are more constricted and make us more susceptible to upper airway resistance or even obstructive sleep apnea, which then leads to being at risk for all these issues that I've mentioned previously. So, yeah, if you want to get into the science, take a look at that book called Intermittent Hypoxemia or Hypoxia in Human Diseases. And I think you'll really find that fascinating. So, what are we doing about this disease? You know, if we know that it's so bad, if we know that intermittent hypoxia or lowering of oxygen is so bad, what can we do about it? Well, there's some basic options that are out there. One being that you can go on CPAP and you can have a mask strapped to your face and mouth, nose area, which will help you breathe. And frankly, if I'm in an emergency state and not breathing, I would hope somebody would throw some oxygen on me and put a mask on me and get me breathing again so that I don't develop any further brain damage. But do I want to keep that on for my entire life? And what would that do to me potentially as we think about it, when you apply a force to the body, or if you take away the body's own ability to perform a function, the body's amazingly economical. It will, it's just like using a muscle. If you don't use it, you lose it. And perhaps that's what may happen when we have a machine that breathes for us. Is it possible that those breathing muscles atrophy and shrink and lose some of their function, and then over time we become more and more dependent upon it? I'm not aware of any studies that suggest that, but just from a reason, a logic standpoint, I think that that's reasonable to consider that as a possible outcome of long-term use. I have seen a recent study of the second more common type of treatment, which is the use of oral airway appliances, or another word is called mandibular advancement devices. And these are what dentists who are trained to provide sleep breathing disorder treatments to be able to give to individuals who can't tolerate CPAP. And they are recommended by the American Academy of Sleep Medicine as great treatment for mild to moderate obstructive sleep apnea. And Medicare suggests that the rate of non-compliance, in other words, people that just can't wear their CPAP after a year, is up as high as 40%. People continue to say, or in other words, 60% of them fall off the wagon wearing their CPAP. And boy, if you have such a horrible condition that subjects you to these so many risks, surely there's got to be other ways to treat your condition. So that's been the second alternative for people. And for years, I provided this modality to my patients. The big problems I found was that although I felt great that they were starting to breathe better and they were enjoying the health benefits of having it, such as, I'd often have them come back saying, yeah, I'm off my medication for depression and anxiety, and I'm starting to get off my diabetes medications and things like that because I'm getting healthier and my physician's taking me off those. Besides those wonderful stories, I was also having people come back saying, I just can't feel my back teeth touch. And it's more difficult to chew food. It's, do I need braces? Am I going to have to, have some jaw alignment things done to help me regain my bite? And most often they would say, but boy, I'm sure glad that my airway is supported and I'm breathing now. But dang, I just don't want to have to deal with these bite changes. And sure enough, that is what happens. It's the lower piece of the oral device is connected to an upper piece by a bar, and it's kind of like having a headgear. The forces on the upper jaw pull it back, and in order to anchor the lower jaw to bring it forward to open your airway, and consequently, over time, if you put force on the body's going to change its shape. So, great treatment, but definite downsides. And there was a recent study out of 9 patients that it was not so recent, maybe 2017, where it suggested that the sample size of 9 patients who wore their appliance over a 15-year period, when they came back, they were sleep tested again, and their original sleep test showed sleep apnea, where they would stop breathing an average of 17 times per hour. And now they were stopped breathing 31 times per hour. And so their sleep apnea is actually getting worse and not being permanently corrected. So, what is out there that can help us permanently change a person's airway who has this serious medical condition? Well, there is technology that is available to patients called biomimetic therapy, biomimetic appliance therapy. And the idea is that you can use an oral device to trigger or signal or stimulate the growth centers of the face and jaw area. Those growth centers are called sutures and tooth sockets. And they have things called stem cells. Stem cells are like little sleeping cells that need to be wakened whenever they're called upon to turn into another type of cell, like bone or blood vessel or nerve. And you can, if you wear a device, and this is what I do in practice, and it's a wonderful treatment. If a person wears a device about half their life over a 6 to 18-month period, then you can, which means 12 hours per day per 24, that includes sleep time, then you can gently stretch those little sutures, the mechanoreceptors is what we call them, these little areas in those growth centers. If you gently stretch them and don't cause pain, you can turn on those or activate those sleeping cells called stem cells, and they will grow new bone or grow more bone and develop to their genetically more optimal shape and size, which means we get a more genetically optimal airway space to breathe through, which is awesome. Just imagine. And we see it all the time because people get braces, and we see how mouths change so significantly with those light forces. Sometimes they're heavy forces and it's painful. Boy, do I remember as a kid having those braces and picking off my wires because they were so painful. This is not what I'm talking about. What I'm talking about is gentle stretching of those areas to stimulate growth and to open up the breathing passages in the process. That's a wonderful technology. We can use it for children and adults. There's hope for all of us out there that these techniques are available. There's a growing number of dentists who are learning about these things and who are going to be prepared to help lots of people who desire this type of care. I do work within a team of physicians. Anybody and everybody who can contribute to improving sleep quality, I want to work with. And literally that in some way can be everyone. And for example, if someone has a deviated septum in their nose or enlargement of anatomy in the nose, they get to go see a ear, nose, and throat specialist who will analyze those areas and give them recommendations. Just by changing the mouth doesn't necessarily change everything that needs to be changed in the nose. And so we want to make sure that's taken care of. And sometimes people are just really allergic to foods or non-foods. Dairy and eggs are very common, or processed foods are very commonly result in nasal congestion. And so we also want to, I frequently suggest patients talk with a counselor. And so, for example, if somebody has had a traumatic event in their life emotionally, let's say they were abused, and they have recurrent memories about the time they go to bed, then that can create cortisol levels increase and adrenaline increase. And then they obviously won't sleep well if that's going on, despite whether or not they're breathing well. So it's very much a comprehensive approach. There's hope for all you out there to have a starting point to enable your bodies to heal during that appropriate time that they heal, which is during sleep. And in the process, you're able to unleash that incredible power that the body has. So I hope today was helpful to you to get a kind of an increased understanding of how important it is to breathe well as we sleep so that you can enjoy all those health benefits that sleep has available for our bodies, and to help us and our children and our grandchildren avoid these human diseases that are so frequently related to poor sleep quality. So just remember, there is hope for you. There's great treatment that's out there and available. Feel free to contact us on our website, and we can give you more information on where to go for this. Hope this has been helpful to everyone, and I hope you've had a wonderful day today and realize that there's great information available in future podcasts that we'll share with you. We'll go into even more depth about these certain diseases that we've mentioned. in future podcasts. All right, take care, everyone.